which is of course led by Xi Jinping, as the country is facing a massive surge in cases due to the emergence of an Omicron subvariant, which is BF7, that is slowly becoming the variant of concern across different parts of the world. The situation in China has sparked alarm across the world, and its neighbors, including India, are now keeping a very close watch. Let us first tell you what's been happening in China. Video after video is now coming out from across the country, showing packed crematoriums as well as hospitals. These videos tell you about the grim situation in China, which is currently prevalent, with the danger possibly of millions being infected by the latest wave. And as China battles this latest variant, reports from China now suggest that another brutal clampdown, with people now being forcibly detained in isolation wards in Shanghai, those are now trickling down as well. But as these alarming videos now emerge from our neighboring country, how prepared really is India to fight this variant of concern? The answer appears to be an emphatic yes, and let's tell you why. Now, about 96% of the vaccines that have been so far administered in India are Covishield and Covaxin, while China administers the Coronavac, or the Sinovac as it's called, and the Sinopharm. Now, Covishield has managed to have an efficacy of approximately 76% compared to just 60% of Coronavac. Covishield has an efficacy of about 67% for the 80-plus age group compared to just 30% efficacy for the same age group in China. And when we talk about herd immunity, India has a higher natural immunity compared to China due to the latter's strict COVID-19 lockdowns. Remember, India has recorded over 45 million COVID-19 cases compared to only 2 million in China, as per China's official figures, by the way. That equates to over 32,000 cases per million people here in India compared to a little over 1,300 cases in China per million people. Also remember that the BF7 variant is a subvariant of Omicron, a parent variant that was behind a spike in cases in December 2021, which means that India is likely now to be better prepared for the prevention of the spread of this subvariant of Omicron as compared to China. And to in fact discuss this matter a bit further with us, including of course the implications of the spread of this variant in both China as well as India and how the two countries have actually managed it, we're joined by Jennifer Zeng, an author and human rights activist, and also Dr. NK Mehra, the former dean of the All India Institute of Medical Sciences and also the honorary emeritus scientist at the Indian Council for Medical Research. Jennifer Zeng, coming to you first and foremost. There was an interesting op-ed in the Indian papers recently that one of the reasons why India has actually managed to handle this pandemic far better than China is probably because of the fact that we are a transparent and an open democracy as compared to the authoritarian system that China has embraced, and therefore Xi Jinping as well as the Chinese Communist Party is not directly accountable to the people there in the same way that the current dispensation in India is to its own people. What would you say of that assessment?
I 100% agree with it. Like this, on the other hand, the CCP has been trying to stress they have a so-called a system advantage over democratic countries in terms of COVID control. At least that was the narrative they have been giving in the past 3 years before they were forced to lift the lockdowns because they realized at that stage it was already a total failure. So now, because I think the CCP didn't care about or doesn't care about human life, so during strict lockdown, the Chinese people in 3 years, they were not exposed to any of the variants or the different strains of viruses, and now they were suddenly left on their own without proper protection. And actually, I think the CCP has a policy to have all the people be be infected as soon as possible, like to have the cases to jump as fast as possible, because that is called using using the infection numbers to trade for time. If you want to drag down that process, of course, the infection will be slower, and I think the medical system will be better to handle all these infections. But in China, they are adopting the totally opposite, irresponsible method, which I call trade lives for time. They want to get this thing as quickly over as quickly as possible. That was very irresponsible.
Okay, let's take this across to Dr. NK Mehra as well. Dr. Mehra, during the second wave, the Delta wave of COVID-19 in India, which was quite devastating, over a period of time, we did see the central government delegate the responsibility of imposing lockdowns in a very decentralized manner, eventually to the state governments. But in China, there's been a central authority in power which is imposing extremely harsh lockdowns as part of its zero COVID policy. Do you believe that has proven counterproductive?
Yes, I think you, at the beginning of your talk, you really summarized it very, very well. There's a clear-cut difference between the way India has handled the pandemic and China. China began with zero COVID policy. It was very helpful in the earlier stages of the pandemic, but then they continued with the same. With the result that over 2 years, therefore, the number of people who got exposed to the natural infection in China has been very low as compared to India. The India during the Delta wave, and then the wave that came from Omicron towards the end of December last year and went on until about the February this year, the number of people who got infected was very high. And the natural immunity is supposed to be always better. And when our people, with the natural immunity, they got also the vaccination doses, actually, there is what is called the hybrid immunity, sterilizing immunity over there. So I think that was not the case in China. In China, of course, last month, when they opened up, because of the demonstrations and all that, huge population was actually not exposed to the infection.
Okay.
And they have first time seen the BF.7. BF.7 is known to be more infectious,
yes,
and therefore you're seeing rising numbers of infections in China. I think this policy that China followed right from the beginning of zero COVID has probably not been very successful as we come to nearly the end of the pandemic.
Okay, Ms. Zheng, China went to the world claiming that they've managed to handle the pandemic far superior to the others. At least that was the claim that appeared to come out of China towards the end of the first wave. And there was a sense of vaccine nationalism in China as well, because their vaccines too were indigenously developed. But are those claims now being severely undermined because the vaccines administered clearly have not been able to shield a significant part of the Chinese population now during the wave caused by the B7 variant?
Yes, definitely. People are now seeing so many people around themselves. Their colleagues, their families got infected, and some families got killed by the disease. So now they realize there must be something terribly wrong. And the news has been spread that China has refused to accept America and Germany's offer to support China with free vaccine, but the CCP declined the offer because they don't want to lose face. For the dictators, the face, saving their own face, is so much more important than saving people's lives. So I think the Chinese population are totally left on their own, and they even don't have proper medicine. And the pharmaceutical factories as well as the hospitals were
Yes.
not notified in advance that the CCP will end the lockdown so that they can prepare themselves. So
Okay.
totally no preparation at all, very irresponsible.
Dr. Mehra, coming to you now specifically with regards to our vaccination policy, not only have our vaccines proven effective so far, India also indulged indulged in a policy called Vaccine Maitri, which was part of a vaccine outreach to other countries, which has earned us an enormous amount of goodwill. How would you talk about the way in which India has approached its vaccination policy in contrast to that of China?
Oh, very nice. I think extremely good, and it is all, the plan that India made was all scientifically based. Yesterday somebody was asking me, China also gave vaccines outside of China to a lot of countries over there. They are not seeing as many infections now, but they were not following the policy of China. And my feeling is in the next 2 or 3 months, China is going to see a number of infections. Infection numbers are going to rise very much, like we saw in India during the Delta wave and the Omicron wave.
Okay.
You saw and you showed that India already had about 45 million people who got infected compared to very, very small number in China. But this is going to grow now that they have removed this zero thing. The numbers are going to grow. And my feeling is that in about 1 or 2 months' time, this infection will then calm down because there will be natural infection there.
Okay, Ms. Zeng as well as Dr. Mehra, thank you so much for that very insightful perspective on how the two countries have actually fought the pandemic and the differences in their approaches. Many thanks. We'll slip into a short break now. We'll come back with a lot more lined up for you on the other side.